We at the Population Health Research Institute in Canada, along with our colleagues in Colombia, Malaysia, and the United Kingdom, have been working to address cardiovascular risk with the HOPE4 study. Hypertension is a significant contributor to the global burden of cardiovascular disease. We know that medications to reduce blood pressure reduce cardiovascular events and mortality. Unfortunately, hypertension detection, treatment, and control is low around the world. We also know that statins reduce cardiovascular disease in those with hypertension. Unfortunately, statins are used in less than 5% of this population. We set out and did 2 systematic reviews and health system appraisals in Colombia and Malaysia to help identify the barriers to hypertension control as well as cardiovascular risk reduction. This information then informed the design of the HOPE4 study. The HOPE4 intervention itself was comprised of 3 core components. The first is that of task sharing with non-physician health workers that are enabled with tablet-based computers with simplified algorithms for the management and counseling of cardiovascular risk. The second component of the intervention was combination antihypertensives along with a statin that was recommended by the non-physician health worker but supervised by local primary care physicians. And the third component is that we involved family and friends to help with adherence to medication as well as healthy behaviors. The HOPE4 study was an open, community-based, cluster randomized controlled trial involving 30 communities in Colombia and Malaysia. We included individuals with new or poorly controlled hypertension. We ended up randomizing 30 communities with 1,371 individuals to intervention or control. At 12 months, we had 97% follow-up with respect to the primary outcome. The HOPE4 intervention demonstrated a significant reduction in the primary outcome, which was the reduction in the Framingham risk score. We demonstrated an absolute 11.2% reduction in the intervention group versus 6.4% reduction in control. This greater than 40% reduction was quite significant. We found this effect based on reductions in blood pressure and cholesterol lowering. With blood pressure, we had an absolute 11 millimeter drop in systolic blood pressure, and with cholesterol, we had a 0.4 millimole per liter reduction in LDL as compared to control. We also had a doubling in blood pressure control status in the intervention group as compared to control. We also saw that there was significant improvements in medication adherence and several healthy behaviors. The HOPE4 study is a comprehensive intervention. It involves task sharing with non-physician health workers, provision of free antihypertensive and statin medications, along with computer support and involving family and friends and primary care physicians. This intervention had a significant impact on cardiovascular risk as well as hypertension control. We feel that if this intervention is adapted to local contexts, as well as scaled to several countries, we can significantly address the United Nations General Assembly Action Plan for a 1/3 reduction in premature cardiovascular mortality.